CSU students were used as paramedics for these demonstrations. Hi there and welcome to this CSU skills video on how to perform a Vagal manoeuvre. This video is part of a series of skills videos designed for our paramedic course to assist teaching the practical skills components of our degree program. Today we're going to teach you about how to perform a Vagal manoeuvre. You may not be aware yet, but there are several different ways that you can perform a Vagal manoeuvre, and we'll look at how to do this, and when and where this might be indicated. This video is broken down into steps, so you can review in your own time and take notes. Okay, so first look at the reasons why you want to perform a Vagal manoeuvre, and what your indications are for doing so. For this session we are first going to talk about tachycardias, their differentiation and their treatment. As you are already aware, tachycardias are heart rates that are over 100 beats per minute. Not every tachycardia is a problem for the patient, and for the most part these are a normal reaction to stress, exercise or excitement. Sometimes the body uses a tachycardia when we are sick to circulate blood and oxygen faster around the body, and this is a necessary way to compensate for an increase in metabolic demand. If in the case the patient has a tachycardia due to infection or another sickness, your best care may involve supporting the patient with basic cares, like oxygen and fluid, before deciding if the tachycardia requires any treatment or is best left alone. So when will we want to do something about a tachycardia? If in the case of the tachycardia, you believe the patient is suffering these related symptoms, it may be a good idea to treat the tachycardia. Shortness of breath, this may be tachypnea, unrelated to a respiratory cause, or may present as acute pulmonary edema. Chest pain or myocardial ischemia, related to the rate being too fast and not allowing filling time in the heart. Dizziness or a lack of cerebral perfusion, caused by poor blood flow to the brain. The patient may have had a syncope. Other signs of poor perfusion include hypotension, poor skin colour, clammy or pale. In this video, our focus is discussing the narrow complex tachycardia, and in particular, the supraventricular tachycardia, also called SVT. Your lecturer will discuss SVT in greater detail in your tutorial, but for today's video, we'll give you a brief overview. During an episode of SVT, the heart's electrical system doesn't work correctly, causing the heart to beat very fast. The heart beats at least 100 beats per minute and may reach 300 beats per minute. SVT can come on at any time and generally is not from causes such as exercise, high fever or stress. SVT includes three main types of arrhythmias. These are atrial tachycardia or AT. This is caused by an irritable site in the atria. AV nodal reentrant tachycardia, where there are fast and slow pathways that spin around the AV node causing a tachycardia. And lastly, AV reentrant tachycardia, where an impulse comes from the atria but uses an accessory pathway to get to the ventricles. In all cases of SVT, you will need to identify the rhythm first, assess the patient thoroughly, and discuss your treatment options with your partner and the patient. You will also need to work within your treatment guidelines for the area that you work in. Assess your patient and complete a full set of baseline vitals. If the patient appears poorly perfused, apply oxygen and move them to a position of comfort, ideally reclining if possible. If they have difficulty breathing, you may need to use a semi-recumbent position. Perform an ECG and confirm that this is an SVT. The QRS complex will be narrow and the P waves will be abnormal if you are able to see them. The rate will generally be above 150 beats per minute. If the SVT is continuous and sustained, a Vagal manoeuvre should be performed. Vagal manoeuvres are often used to attempt to revert or slow an SVT into a more normal sinus rhythm. Vagal manoeuvres can be successful in up to 25% of cases if correctly performed by the paramedic, with many failures being due to incorrect instructions given by the paramedic to the patient. The most common Vagal manoeuvre used in pre-hospital practice today are the Valsalva for competent children and adults, and the simple ice or cold compress technique for children. You may have also heard of the carotid sinus massage. This is infrequently used in pre-hospital practice due to the risk of causing a brain embolism. The patient should ideally be laid in a flat position and asked to blow into a 20 to 50 ml syringe. They should attempt to sustain this for a minimum of 15 to 20 seconds. An alternative to this is to ask the patient to bear down, like they're having a bowel motion, or to even blow into a BP cuff to maintain a reading of 40 millimeters of mercury, again for a minimum of 15 to 20 seconds. During this time you may see the patient's face go red. This is normal. A third alternative to the above is to have the patient curl their fingers on both hands and then link both hands together in the front of their chest. Deep breath, and then to try forcibly pull their hands apart. Reversion takes place after the patient blows out and takes a new breath. In children, the described method can also be used if a child can demonstrate competency in the technique. Another alternative in children is to bring the knees to the chest in the child laying supine and hold for approximately 10 to 15 seconds. This may have the same effect. If using the Valsalva method does not work in a child, the following ice methods can be applied. Place crushed ice in a plastic bag, glove, or cloth and apply over the face for approximately 15 seconds until the rhythm changes or the patient's condition dictates immediate cessation of the procedure. Do not occlude the nose or mouth and provide constant reassurance to the child. When a person forcefully expires against the closed glottis, changes occur in the intrathoracic pressure that dramatically affects venous return, cardiac output, arterial pressure, and heart rate. Initially during a Valsalva, intrathoracic pressure becomes very positive due to the compression of the thoracic organs by the contracting rib cage. This increased external pressure on the heart and thoracic blood vessels compresses the vessels and cardiac chambers. Venous compression and the accompanying large increase in the right atrial pressure impedes venous return into the thorax. This reduced venous return, and along with compression of the cardiac chambers, reduces cardiac filling and preload that leads to a fall in cardiac output. At the same time, compression of the thoracic aortic transient increases aortic pressure, phase 1. However, aortic pressure begins to fall, phase 2, after a few seconds because cardiac output falls. Changes in heart rate are reciprocal to the changes in aortic pressure due to the operation of the baroreceptor reflex. During phase 1, heart rate decreases because aortic pressure is elevated. During phase 2, heart rate increases as the aortic pressure falls. When the person starts to breathe normally again, aortic pressure briefly decreases as the external compression on the aorta is removed, and heart rate briefly increases reflexively, phase 3. This is followed by an increase in aortic pressure and a reflex decrease in heart rate, as the cardiac output suddenly increases in response to a rapid increase in cardiac filling, phase 4. Aortic pressure also rises above normal because of a baroreceptor. Sympathetic mediated increase in systemic vascular resistance that occurred during the Valsalva. Similar changes occur whenever a person conducts a forced expiration against either a closed glottis or high pulmonary outflow resistance, or when the thoracic and abdominal muscles are strongly contracted. This can occur when a person strains while having a bowel movement. Similar changes can also occur when a person lifts a heavy weight while holding their breath. Always remember to treat the patient and not the rhythm, and start with a good assessment and a basic set of vital signs before you make any treatment decisions. You have now come to the end of the skills video. You should go back and replay any parts that you are not sure about now.